Hello, nursing students. Welcome to our channel, Nursing Exam Preparation. In this video, we'll guide you through the top 250 maternal care true or false questions and answers, each accompanied by detailed explanations to help you fully understand the concepts. This comprehensive resource is designed to support your nursing exam preparation, providing you with the tools needed to excel in maternal care and approach related questions with confidence. Feel free to watch the video as many times as you need. Repetition is essential for mastering the material and reinforcing your understanding. Whether you're just beginning your studies or doing a final review, these questions will challenge your knowledge, promote critical thinking, and solidify key maternal care principles. Don't forget to like the video, share it with your fellow students, and subscribe to Nursing Exam Preparation for more valuable content to support your success. Be sure to hit the bell icon to stay updated with all our latest videos, packed with tips, strategies, and exam-focused resources. After watching, leave a comment below with your score. We'd love to hear how you did. Let's dive into the field of maternal care, strengthen your skills, and get ready to ace your exams with confidence. 1. The first trimester is the most critical period for fetal development. True or false? Answer: true. Rationale: the first trimester is crucial because it is when the major organs and systems begin to develop. The fetus is especially vulnerable to teratogens, such as drugs or infections, which can cause malformations during this period. 2. A pregnant woman can safely drink 1 to 2 cups of coffee per day without increasing the risk of miscarriage. True or false? Answer: false. Rationale: excessive caffeine consumption during pregnancy, over 200 to 300 mg/day, has been associated with increased risk of miscarriage, low birth weight, and preterm birth. 3. During labor, the latent phase is the stage when the cervix dilates from 0 to 3 centimeters. True or false? Answer: true. Rationale: the latent phase of labor is characterized by slow, early cervical dilation, typically from 0 to 3 centimeters. It is often the longest phase of labor, and contractions start off irregular and mild. 4. The placenta produces the hormone progesterone, which maintains the pregnancy by preventing uterine contractions. True or false? Answer: true. Rationale: progesterone, produced by the placenta, helps maintain the pregnancy by preventing uterine contractions and preparing the endometrial lining to support the growing fetus. 5. Preeclampsia is characterized by hypertension and proteinuria occurring after the 20th week of pregnancy. True or false? Answer: true. Rationale: preeclampsia is a pregnancy complication that occurs after the 20th week and is marked by high blood pressure and proteinuria. It can result in severe maternal and fetal complications if untreated. 6. Gestational diabetes is a condition that occurs only in women who are obese. True or false? Answer: false. Rationale: while obesity increases the risk of gestational diabetes, it can also occur in women of normal weight. Other risk factors include a family history of diabetes, advanced maternal age, and a history of gestational diabetes. 7. A cesarean section is indicated when the baby is in a breech position after 37 weeks gestation. True or false? Answer: true. Rationale: a breech presentation after 37 weeks increases the risk of complications during vaginal delivery. Cesarean section is often recommended to avoid potential injury to the baby. 8. A woman with hyperemesis gravidarum typically experiences severe vomiting and dehydration during pregnancy. True or false? Answer: true. Rationale: hyperemesis gravidarum is a severe form of nausea and vomiting in pregnancy, leading to dehydration, weight loss, and electrolyte imbalances. It often requires medical intervention for hydration and nutrition. 9. It is safe to administer vaccines to a pregnant woman, including the MMR vaccine. True or false? Answer: false. Rationale: live vaccines, such as the MMR, measles, mumps, rubella, should not be given during pregnancy due to the potential risk to the fetus. Inactivated vaccines, however, are generally considered safe. 10. The uterus should be located at the level of the umbilicus by 20 weeks gestation. True or false? Answer: true. Rationale: by 20 weeks, the uterus typically reaches the level of the umbilicus. This is a key milestone in fetal growth and helps assess gestational age during prenatal exams. 11. A healthy newborn should breathe on its own immediately after delivery, without any assistance. True or false? Answer: true. Rationale: most healthy newborns initiate breathing on their own immediately after birth. However, some may require minor interventions such as suctioning or gentle stimulation to start breathing. 12. A postpartum mother should avoid breastfeeding if she is diagnosed with mastitis. True or false? Answer: false. Rationale: breastfeeding is encouraged even with mastitis, as it helps to clear the infection. The mother may need antibiotic treatment, and proper nursing techniques should be used to avoid further complications. 13. A woman with placenta previa should avoid vaginal exams during pregnancy. True or false? Answer: true. Rationale: vaginal exams in a woman with placenta previa can cause bleeding and should be avoided. The condition can be diagnosed with ultrasound and managed with careful monitoring to prevent complications. 14. Maternal weight gain of 30 to 35 pounds is recommended for women with a normal BMI during pregnancy. True or false? Answer: true. Rationale: for women with a normal BMI, the recommended weight gain during pregnancy is 25 to 35 pounds. This supports optimal fetal growth and maternal health. 15. The fetal heart rate is typically between 110 and 160 beats per minute in a healthy pregnancy. True or false? Answer: true. Rationale: a normal fetal heart rate ranges from 110 to 160 beats per minute. Deviations outside this range may indicate fetal distress or other complications. 16. Preterm labor is defined as labor that occurs before 37 weeks of gestation. True or false? Answer: true. Rationale: preterm labor occurs before 37 weeks gestation and can result in preterm birth. Early detection and management are critical to reduce risks for the newborn. 17. The second stage of labor is when the cervix dilates from 10 centimeters to fully open. True or false? Answer: false. Rationale: the second stage of labor begins when the cervix is fully dilated to 10 centimeters and ends with the delivery of the baby. The first stage involves cervical dilation. 18. It is normal for a postpartum mother to experience heavy bleeding for up to 6 weeks after childbirth. True or false? Answer: false. Rationale: while some vaginal bleeding, lochia, is expected after childbirth, excessive or prolonged bleeding beyond 6 weeks can be a sign of complications, such as retained placenta or infection. 19. A Rh-negative mother should receive Rh immunoglobulin rhogum if her baby is Rh positive. True or false? Answer: true. Rationale: Rh-negative mothers who deliver Rh-positive babies should receive Rh immunoglobulin rhogum to prevent Rh incompatibility, which can cause hemolytic disease in future pregnancies. 20. The APGAR score is used to assess a newborn's physical condition immediately after birth. True or false? Answer: true. Rationale: the APGAR score assesses a newborn's heart rate, respiratory effort, muscle tone, reflexes, and skin color. It is done at 1 and 5 minutes after birth to determine the need for immediate medical intervention. 21. Vaginal bleeding after 24 weeks of pregnancy is always a sign of preterm labor. True or false? Answer: false. Rationale: vaginal bleeding after 24 weeks may indicate complications such as placenta previa, placental abruption, or other issues, but it is not always a sign of preterm labor. Immediate medical evaluation is needed. 22. The normal range for maternal blood pressure during pregnancy is the same as for non-pregnant women. True or false? Answer: false. Rationale: blood pressure may slightly decrease during the second trimester of pregnancy due to hormonal changes. However, significant increases in blood pressure, e.g., preeclampsia, can lead to maternal and fetal risks. 23. A urine test during pregnancy can detect gestational diabetes. True or false? Answer: false. Rationale: gestational diabetes is diagnosed through a glucose tolerance test, not a urine test. Urine tests can detect protein or glucose but are not specific for gestational diabetes. 24. It is common for a mother to experience post-birth baby blues characterized by mood swings and irritability. True or false? Answer: true. Rationale: baby blues are common in the first few days after delivery due to hormonal shifts and the adjustment to motherhood. These feelings usually resolve within a couple of weeks. 25. A woman who has had a cesarean section should avoid lifting anything heavier than her baby during the first few weeks postpartum. True or false? Answer: true. Rationale: postpartum recovery after a cesarean section includes avoiding heavy lifting to prevent strain on the surgical site and reduce the risk of complications such as wound dehiscence. 26. Maternal smoking during pregnancy increases the risk of preterm birth and low birth weight. True or false? Answer: true. Rationale: smoking during pregnancy can restrict fetal growth and increase the risk of preterm birth, low birth weight, and other complications such as placental abruption and stillbirth. 27. The recommended timing for a prenatal ultrasound is at 12 weeks to confirm pregnancy and at 20 weeks to assess fetal development. True or false? Answer: true. Rationale: the first ultrasound at around 12 weeks confirms pregnancy and estimated due date, while the second at 20 weeks assesses fetal anatomy, growth, and detects any structural abnormalities. 28. It is safe for a pregnant woman to take over-the-counter medications without consulting her healthcare provider. True or false? Answer: false. Rationale: many over-the-counter medications can be harmful during pregnancy. A healthcare provider should always be consulted before taking any medication, even those considered safe in non-pregnant individuals. 29. Severe back pain is a normal symptom of pregnancy and should not be a cause for concern. True or false? Answer: false. Rationale: while mild back pain can occur due to hormonal changes and weight gain, severe back pain, especially if it is sudden or associated with other symptoms, could indicate complications like a kidney infection or preterm labor. 30. A vaginal delivery is recommended for women with a history of a previous cesarean section, provided there are no contraindications. True or false? Answer: true. Rationale: vaginal birth after cesarean (VBAC) is often possible and recommended for women who have had one previous cesarean section and no contraindications. However, the risks and benefits should be carefully considered with a healthcare provider. 31. Vaginal bleeding after 12 weeks of pregnancy is always a sign of miscarriage. True or false? Answer: false. Rationale: vaginal bleeding after 12 weeks can indicate complications like placenta previa, placental abruption, or cervical issues, but it does not always mean a miscarriage. Proper evaluation is needed. 32. A prenatal visit should occur every 4 weeks during the first 28 weeks of pregnancy. True or false? Answer: true. Rationale: during the first 28 weeks of pregnancy, a standard recommendation is a prenatal visit every 4 weeks to monitor maternal and fetal health and detect any complications early. 33. Fetal movements should be felt by the mother starting at around 20 weeks of gestation. True or false? Answer: true. Rationale: fetal movements, often called quickening, are typically felt between 18 to 25 weeks in first-time pregnancies. After 20 weeks, most mothers will feel regular movement. 34. If a mother tests positive for Group B streptococcus, GBS, she will need antibiotics during labor to prevent transmission to the baby. True or false? Answer: true. Rationale: GBS screening is done between 35 to 37 weeks of pregnancy. If a mother tests positive, intravenous antibiotics during labor help reduce the risk of the baby contracting GBS, which can lead to serious infections. 35. In the third trimester, a mother should increase her caloric intake by an additional 300 to 500 calories per day. True or false? Answer: true. Rationale: during the third trimester, increased calorie intake supports fetal growth and maternal energy needs. An additional 300 to 500 calories per day is recommended, especially for women with a normal pre-pregnancy weight. 36. A healthy pregnancy typically involves the absence of any significant discomfort. True or false? Answer: false. Rationale. Pregnancy is often associated with discomfort such as nausea, fatigue, and back pain. While many women experience mild symptoms, discomfort is common and varies by individual. 37. Preterm birth is defined as delivery occurring before 37 weeks of gestation. True or false? Answer: true. Rationale. Preterm birth refers to the birth of a baby before 37 weeks of gestation. Preterm infants are at higher risk for complications, such as respiratory distress syndrome and developmental delays. 38. It is safe for a pregnant woman to continue vigorous exercise throughout her pregnancy, as long as she feels comfortable. True or false? Answer: false. Rationale. While moderate exercise is generally safe during pregnancy, vigorous exercise may increase the risk of complications, especially in high-risk pregnancies. Always consult a healthcare provider before engaging in intense physical activity. 39. The most common type of anemia during pregnancy is iron deficiency anemia. True or false? Answer: true. Rationale. Iron deficiency anemia is the most common form of anemia during pregnancy due to increased blood volume and the higher iron demands of fetal growth. Supplementation is typically required. 40. A woman who had a previous cesarean section should be advised against a vaginal birth for future pregnancies. True or false? Answer: false. Rationale. Many women with a previous cesarean section can safely attempt a vaginal birth in future pregnancies, VBAC, unless there are contraindications. The risks and benefits should be evaluated for each case. 41. A positive urine glucose test during pregnancy always indicates gestational diabetes. True or false? Answer: false. Rationale. A positive urine glucose test does not necessarily indicate gestational diabetes. It may reflect temporary increases in blood sugar levels. A formal glucose tolerance test is required for diagnosis. 42. Maternal fever during labor may indicate an infection and requires prompt evaluation. True or false? Answer: true. Rationale. Maternal fever during labor can be a sign of infection, such as chorioamnionitis, which can lead to serious complications. Prompt evaluation and treatment are necessary to prevent harm to both mother and baby. 43. All women are screened for preeclampsia during pregnancy using a blood pressure measurement and urine protein test. True or false? Answer: true. Rationale. Preeclampsia is commonly screened during pregnancy through routine blood pressure measurements and urine protein tests. Early detection is essential for preventing maternal and fetal complications. 44. Pregnancy can cause a woman's immune system to become suppressed, making her more susceptible to infections. True or false? Answer: true. Rationale. Pregnancy causes changes in the immune system, including a mild suppression of certain immune responses, to prevent rejection of the fetus. This makes pregnant women more susceptible to some infections. 45. Pregnant women should avoid consuming fish due to the risk of mercury exposure. True or false? Answer: false. Rationale. Pregnant women are encouraged to eat fish due to its high omega-3 fatty acids, but they should avoid fish high in mercury, such as shark, swordfish, and king mackerel. Safe fish options should be chosen. 46. A pregnant woman with a BMI of 30 or greater is considered to be at increased risk for gestational hypertension and preeclampsia. True or false? Answer: true. Rationale. Obesity increases the risk of several complications during pregnancy, including gestational hypertension and preeclampsia, which are associated with higher rates of morbidity and mortality. 47. The risk of having a child with a neural tube defect increases when the mother does not take folic acid supplements before conception. True or false? Answer: true. Rationale. Folic acid supplementation before conception and during early pregnancy significantly reduces the risk of neural tube defects, such as spina bifida and anencephaly. 48. It is safe to consume alcohol in moderation during pregnancy if the mother is in good health. True or false? Answer: false. Rationale. There is no known safe amount of alcohol during pregnancy. Alcohol consumption can lead to fetal alcohol syndrome, which causes severe developmental and physical disabilities. 49. It is recommended for pregnant women to receive the influenza vaccine to protect both themselves and the baby.
True or false?
Answer: true. Rationale: the influenza vaccine is recommended for pregnant women to prevent flu-related complications, which can be more severe during pregnancy. It also helps protect the newborn, who cannot receive the flu vaccine until later in life. 50. A cesarean section is often performed if the baby is found to be in a transverse lie position.
True or false?
Answer: true. Rationale: a transverse lie, where the baby is positioned sideways in the uterus, usually results in a cesarean section due to the difficulty of a vaginal delivery and the risk of cord prolapse. 51. Postpartum hemorrhage is most commonly caused by uterinotony, which is a failure of the uterus to contract effectively after delivery. True or false? Answer: true. Rationale: uterinotony, or the inability of the uterus to contract after delivery, is the most common cause of postpartum hemorrhage. It can result in significant blood loss and requires prompt management. 52. A woman who is pregnant with twins is more likely to experience preterm labor. True or false? Answer: true. Rationale: women carrying multiples are at a higher risk of preterm labor due to the increased uterine stretch and the higher demands placed on the body. Twins are often delivered before 37 weeks gestation. 53. Women who experience morning sickness during pregnancy are more likely to have a boy. True or false? Answer: false. Rationale: there is no conclusive evidence that the severity of morning sickness correlates with the baby's sex. Morning sickness is related to hormonal changes, particularly high levels of HCG, but not the gender of the baby. 54. It is safe for pregnant women to sleep on their back throughout the entire pregnancy. True or false? Answer: false. Rationale: sleeping on the back during pregnancy, especially in the third trimester, can compress the vena cava, leading to reduced blood flow to the heart and placenta. It is recommended to sleep on the left side to improve circulation. 55. An episiotomy is often performed to prevent tearing during childbirth. True or false? Answer: false. Rationale: episiotomies were once routine, but current guidelines recommend that they should only be performed when necessary, as they increase the risk of complications, including infection and longer recovery. 56. The primary purpose of the umbilical cord is to provide oxygen and nutrients to the fetus. True or false? Answer: true. Rationale: the umbilical cord connects the fetus to the placenta and allows for the exchange of oxygen, nutrients, and waste products between the mother and fetus. 57. Women with gestational diabetes are at a higher risk of developing type 2 diabetes later in life. True or false? Answer: true. Rationale: women with gestational diabetes have an increased risk of developing type 2 diabetes in the future. Monitoring blood glucose levels post-pregnancy is important for early detection. 58. It is recommended for pregnant women to avoid exercise entirely to prevent complications. True or false? Answer: false. Rationale: exercise, when done safely and under medical guidance, can be beneficial during pregnancy. It helps improve circulation, reduce stress, and prepare the body for labor. However, high-risk pregnancies may require restriction of certain activities. 59. A woman who experiences hypertension before pregnancy is at an increased risk of developing preeclampsia during pregnancy. True or false? Answer: true. Rationale: women with a history of hypertension are at higher risk for developing preeclampsia, a condition characterized by high blood pressure and proteinuria after 20 weeks gestation. 60. The Rh factor in pregnancy refers to the presence of a specific protein on red blood cells. True or false? Answer: true. Rationale: the Rh factor is a protein found on red blood cells. If a pregnant woman is Rh negative and her baby is Rh positive, Rh incompatibility can lead to complications, necessitating Rh immunoglobulin (ROGM) treatment. 61. Maternal sleep deprivation during pregnancy has no effect on fetal development. True or false? Answer: false. Rationale: Maternal sleep deprivation can lead to increased stress and hormonal imbalances, which may negatively affect fetal growth and development, potentially increasing the risk of preterm birth. 62. A healthy maternal diet during pregnancy should include a variety of fruits, vegetables, whole grains, and lean proteins. True or false? Answer: true. Rationale: a balanced diet rich in fruits, vegetables, whole grains, and lean proteins supports optimal maternal and fetal health, providing essential nutrients for fetal growth and preventing complications like anemia. 63. The first signs of labor typically begin with the rupture of the membranes, water breaking. True or false? Answer: false. Rationale: while the rupture of membranes, water breaking, can signal the start of labor, it does not always occur first. Contractions are usually the first sign of labor, with the rupture of membranes following shortly after or during labor. 64. A low-lying placenta is a potential cause for concern and may require a cesarean delivery. True or false? Answer: true. Rationale: a low-lying placenta, especially if it is near or covering the cervix, placenta previa, can cause complications such as bleeding during labor and may necessitate a cesarean delivery for the safety of both mother and baby. 65. Pregnancy increases a woman's risk of developing deep vein thrombosis, DVT. True or false? Answer: true. Rationale: pregnancy increases the risk of DVT due to hormonal changes that affect blood clotting, as well as the pressure exerted on veins by the growing uterus. This can increase the risk of clot formation. 66. Women with polycystic ovary syndrome, POS, have a higher risk of infertility and pregnancy complications. True or false? Answer: true. Rationale: PCOS is associated with hormonal imbalances that can lead to irregular ovulation, making it more difficult for women to conceive. It also increases the risk of gestational diabetes, preeclampsia, and miscarriage. 67. The second stage of labor involves the delivery of the placenta. True or false? Answer: false. Rationale: the second stage of labor involves the delivery of the baby. The third stage involves the delivery of the placenta. The stages of labor are classified based on cervical dilation and delivery of the fetus and placenta. 68. Women who experience gestational hypertension are at a greater risk for developing preeclampsia later in the pregnancy. True or false? Answer: true. Rationale: gestational hypertension can progress to preeclampsia if left untreated. This is a serious condition that requires close monitoring and management to prevent complications for both mother and fetus. 69. It is safe for pregnant women to take over-the-counter herbal supplements without consulting their healthcare provider. True or false? Answer: false. Rationale: many herbal supplements are not well studied in pregnancy and can have harmful effects on both mother and baby. Pregnant women should always consult a healthcare provider before taking any supplements. 70. It is recommended for pregnant women to avoid excessive weight gain, as it can lead to complications such as gestational diabetes. True or false? Answer: true. Rationale: excessive weight gain during pregnancy can increase the risk of complications like gestational diabetes, preeclampsia, and large for gestational age babies. The recommended weight gain varies based on the woman's pre-pregnancy BMI. 71. A woman who has an ultrasound at 12 weeks gestation should be able to determine the sex of the baby with certainty. True or false? Answer: false. Rationale: while an ultrasound at 12 weeks may provide clues about the baby's sex, it is often too early to determine with certainty. The best time for sex determination is usually around 18 to 20 weeks of gestation. 72. The presence of a thickened nuchal translucency on an early ultrasound may indicate an increased risk for chromosomal abnormalities, such as Down syndrome. True or false? Answer: true. Rationale: a thickened nuchal translucency seen on ultrasound in the first trimester can be a marker for chromosomal abnormalities, including Down syndrome. Additional testing may be recommended to assess the risk more accurately. 73. Epidural anesthesia is the most common method of pain relief during labor and is generally considered safe for both mother and baby. True or false? Answer: true. Rationale: Epidural anesthesia is commonly used for pain relief during labor. It is generally considered safe for most women, although it may have risks and side effects, such as a drop in blood pressure or difficulty pushing. 74. All women should receive the TAP vaccine during pregnancy to protect the newborn from pertussis, whooping cough. True or false? Answer: true. Rationale: the TAP vaccine is recommended for pregnant women, usually between 27 and 36 weeks, to protect the newborn from pertussis, a potentially deadly respiratory infection. 75. In a multiple gestation pregnancy, it is common for the second baby to be born after a significant delay once the first baby is delivered. True or false? Answer: false. Rationale: in a multiple gestation pregnancy, the second baby typically follows shortly after the first. Delays between the births may indicate complications such as uterine atony or an abnormal fetal position. 76. It is important for pregnant women to take prenatal vitamins that include folic acid to reduce the risk of neural tube defects. True or false? Answer: true. Rationale: folic acid is essential for fetal neural tube development. Taking prenatal vitamins with folic acid before conception and during the early stages of pregnancy can significantly reduce the risk of neural tube defects. 77. Women with a history of spontaneous preterm birth are at a higher risk for delivering prematurely in future pregnancies. True or false? Answer: true. Rationale: women who have had a preterm birth in a previous pregnancy are at higher risk for subsequent preterm deliveries. Close monitoring and preventive measures may be necessary to manage the risk. 78. The presence of protein in the urine during pregnancy may indicate preeclampsia. True or false? Answer: true. Rationale: proteinuria, or protein in the urine, is a key sign of preeclampsia, a condition characterized by high blood pressure and organ dysfunction. Early detection and treatment are crucial to avoid serious complications. 79. A woman can safely undergo routine dental work, such as cleaning and fillings, during pregnancy. True or false? Answer: true. Rationale: routine dental care, including cleanings and fillings, is safe during pregnancy. However, certain dental procedures, such as X-rays or elective surgeries, may need to be postponed or adjusted to minimize risks. 80. Preterm labor is more likely to occur in women who are under 18 or over 35 years old. True or false? Answer: true. Rationale: both young and older pregnant women are at higher risk for preterm labor due to factors such as cervical insufficiency, high blood pressure, or other underlying health conditions. 81. Gestational diabetes is only diagnosed after 20 weeks of pregnancy.
True or false?
Answer: true. Rationale: gestational diabetes is typically diagnosed between 24 and 28 weeks of pregnancy using a glucose tolerance test, as the body's insulin needs increase during this time. 82. Women with gestational hypertension may be treated with antihypertensive medications to prevent complications.
True or false?
Answer: true. Rationale: gestational hypertension may be managed with antihypertensive medications to control blood pressure and prevent complications such as preeclampsia, placental abruption, or fetal growth restriction. 83. All pregnant women should be screened for depression during prenatal visits. True or false? Answer: true. Rationale: screening for depression is recommended during pregnancy to identify mental health concerns early, as untreated depression can affect maternal well-being and fetal development. 84. The placenta is responsible for the production of hormones such as estrogen and progesterone during pregnancy. True or false? Answer: true. Rationale: the placenta produces key hormones, including estrogen and progesterone, that are vital for maintaining pregnancy, supporting fetal growth, and preparing the mother's body for labor. 85. During pregnancy, women should avoid hot tubs and saunas due to the risk of raising their body temperature. True or false? Answer: true. Rationale: high temperatures, such as those in hot tubs or saunas, can raise the core body temperature and increase the risk of neural tube defects or dehydration, making these activities unsafe during pregnancy. 86. Women are at a higher risk of urinary tract infections, UTIs, during pregnancy due to hormonal and anatomical changes. True or false? Answer: true. Rationale: hormonal changes and the growing uterus during pregnancy can lead to urinary stasis and an increased risk of urinary tract infections, UTIs, which should be promptly treated to prevent complications. 87. Pregnant women should be cautious about consuming caffeine, as excessive amounts can lead to increased fetal heart rate. True or false? Answer: true. Rationale: high caffeine intake during pregnancy can cross the placenta and may affect the fetus, potentially leading to an increased fetal heart rate, low birth weight, or preterm birth. It's advised to limit caffeine consumption. 88. It is common for a pregnant woman to experience constipation due to changes in hormonal levels. True or false? Answer: true. Rationale: hormonal changes during pregnancy, particularly increased progesterone, can slow down the digestive system, leading to constipation. Adequate fiber intake and hydration can help manage this issue. 89. During pregnancy, it is important to avoid all medications unless prescribed by a healthcare provider. True or false? Answer: true. Rationale: many medications can cross the placenta and potentially harm the fetus. Pregnant women should only take medications that are approved by their healthcare provider to ensure both maternal and fetal safety. 90. Low birth weight is defined as a baby weighing less than 2,500 grams, 5.5 pounds, at birth. True or false? Answer: true. Rationale: low birth weight is defined as a birth weight of less than 2,500 grams, 5.5 pounds. Babies born with low birth weight are at increased risk for developmental and health complications. 91. A blood test for fetal DNA can determine the sex of the baby as early as 9 weeks of gestation. True or false? Answer: true. Rationale: a blood test for fetal DNA, also called non-invasive prenatal testing, NIPT, can detect the baby's sex and certain genetic conditions as early as 9 weeks of gestation. 92. Preeclampsia can only be diagnosed after 20 weeks of pregnancy. True or false? Answer: true. Rationale: preeclampsia is a condition that typically develops after 20 weeks of pregnancy and is characterized by high blood pressure and proteinuria. It can lead to serious complications if left untreated. 93. The use of epidural anesthesia during labor is associated with an increased risk of cesarean delivery. True or false? Answer: false. Rationale: while an epidural can slow down labor and increase the need for interventions like assisted delivery, it is not directly associated with an increased risk of cesarean delivery. In fact, it can help manage pain in labor, potentially reducing stress. 94. A woman's blood volume increases by approximately 50% during pregnancy. True or false? Answer: true. Rationale: during pregnancy, blood volume increases by about 50% to meet the increased oxygen and nutrient demands of the growing fetus and to accommodate changes in maternal cardiovascular physiology. 95. The first trimester is the safest period for most pregnant women, with the least likelihood of complications. True or false? Answer: false. Rationale: while the first trimester is critical for fetal development, it is also the time when early pregnancy complications, such as miscarriage and ectopic pregnancy, are most likely to occur. 96. A cesarean section is typically recommended if the baby is in a breech position at term. True or false? Answer: true. Rationale: a breech presentation, when the baby is positioned feet or buttocks first, at term often results in a cesarean section to reduce the risks of cord prolapse or trauma during vaginal delivery. 97. Women who are overweight or obese are at a higher risk of complications such as gestational hypertension and cesarean delivery. True or false? Answer: true. Rationale: obesity increases the risk of several complications during pregnancy, including gestational hypertension, preeclampsia, gestational diabetes, and the need for a cesarean section. 98. A woman can safely engage in sexual intercourse throughout her entire pregnancy unless otherwise advised by her healthcare provider. True or false? Answer: true. Rationale: Unless a healthcare provider advises otherwise due to complications like placenta previa or preterm labor risk, sexual intercourse is generally safe during pregnancy. However, comfort levels and preferences may vary. 99. A full-term pregnancy is typically considered to be 39 weeks gestation. True or false? Answer: true. Rationale: a full-term pregnancy is typically considered to be between 39 and 40 weeks of gestation. Babies born during this time are at optimal development for labor and delivery. 100. It is not recommended to get vaccinated during pregnancy, as vaccines can harm the baby. True or false? Answer: false. Rationale: many vaccines are safe during pregnancy, such as the flu vaccine and the TAP vaccine, which protect both the mother and baby. However, live vaccines should be avoided unless absolutely necessary. 101. Prenatal vitamins containing iron and folic acid are essential for reducing the risk of anemia and neural tube defects during pregnancy.
True or false?
Answer: true. Rationale: prenatal vitamins with iron and folic acid are critical for preventing iron deficiency anemia and neural tube defects, which can result from inadequate nutrition during pregnancy. 102. High levels of alpha-fetoprotein, AFP, in maternal blood may suggest a neural tube defect or abdominal wall defect in the fetus. True or false? Answer: true. Rationale: high levels of alpha-fetoprotein, AFP, in maternal blood can indicate the presence of a neural tube defect or other fetal abnormalities, prompting further testing or imaging. 103. During pregnancy, a woman should avoid consuming any form of caffeine, including in chocolate. True or false? Answer: false. Rationale: while it is recommended to limit caffeine intake during pregnancy, moderate amounts, such as those found in chocolate, are typically considered safe. Excessive caffeine, however, should be avoided. 104. Women with a history of preeclampsia are at higher risk for developing it in subsequent pregnancies. True or false? Answer: true. Rationale: women who had preeclampsia in a previous pregnancy are at an increased risk of developing it again in future pregnancies. Monitoring for signs of preeclampsia in subsequent pregnancies is essential. 105. A woman who experiences symptoms of preterm labor should immediately seek medical attention to prevent premature birth. True or false? Answer: true. Rationale: symptoms of preterm labor, such as regular contractions, pelvic pressure, and low back pain, should be evaluated promptly to prevent premature birth and address any underlying issues. 106. Rh incompatibility is more likely to cause problems if the mother is Rh positive and the baby is Rh negative.
True or false?
Answer: false. Rationale: Rh incompatibility issues arise when the mother is Rh negative and the baby is Rh positive. The mother's immune system may produce antibodies that attack the baby's red blood cells. 107. A glucose screening test is routinely performed during the second trimester to check for gestational diabetes.
True or false?
Answer: true. Rationale: a glucose screening test is typically performed between 24 and 28 weeks of gestation to screen for gestational diabetes, a condition that can affect both maternal and fetal health. 108. Women who have had a previous cesarean delivery are always required to have a repeat cesarean in subsequent pregnancies. True or false? Answer: false. Rationale: while women who have had a cesarean delivery are at increased risk of complications during labor, a vaginal birth after cesarean (VBAC) is possible for some women, depending on factors like uterine scar type and other medical considerations. 109. The most common cause of postpartum hemorrhage is uterine atony, which occurs when the uterus fails to contract after delivery. True or false? Answer: true. Rationale: uterine atony, or failure of the uterus to contract after delivery, is the most common cause of postpartum hemorrhage. Adequate uterine contraction is crucial to constrict blood vessels and stop bleeding. 110. Postpartum depression affects only women who have experienced pregnancy complications. True or false? Answer: false. Rationale: postpartum depression can affect any woman, regardless of whether there were complications during pregnancy. It is linked to hormonal changes, lack of sleep, and other emotional factors after childbirth. 111. It is safe for pregnant women to receive dental x-rays, provided proper shielding is used. True or false? Answer: false. Rationale: dental x-rays should generally be avoided during pregnancy unless absolutely necessary, as radiation exposure, even with shielding, could potentially harm the fetus, especially in the early stages of pregnancy. 112. In a multiple gestation pregnancy, there is a higher risk of preterm labor and delivery. True or false? Answer: true. Rationale: multiple gestation pregnancies are at higher risk for preterm labor and delivery due to increased uterine stretch, multiple placental sites, and other factors that can trigger early contractions. 113. It is important for women to rest frequently during pregnancy, especially in the first trimester, to prevent fatigue. True or false? Answer: true. Rationale: frequent rest, especially in the first trimester, is important due to fatigue from hormonal changes and increased metabolic demands. Adequate rest helps prevent overexertion and supports maternal health. 114. A normal weight gain during pregnancy varies based on the woman's pre-pregnancy body mass index, BMI. True or false? Answer: true. Rationale: the recommended weight gain during pregnancy depends on a woman's pre-pregnancy BMI. Underweight women should gain more, while overweight women should gain less to reduce the risk of complications such as gestational diabetes and preeclampsia. 115. During labor, the fetal heart rate should be monitored regularly to assess fetal well-being. True or false? Answer: true. Rationale: continuous or intermittent monitoring of the fetal heart rate is essential during labor to ensure the fetus is not experiencing distress, such as from umbilical cord compression or hypoxia. 116. A woman who experiences heavy bleeding during the first trimester of pregnancy should always be assumed to have a miscarriage. True or false? Answer: false. Rationale: although heavy bleeding can indicate a miscarriage, it is not always the case. Other conditions, such as an ectopic pregnancy or a subchorionic hemorrhage, can also cause bleeding. A thorough evaluation is necessary to determine the cause. 117. Colostrum is the first milk produced by the mother and is rich in antibodies. True or false? Answer: true. Rationale: colostrum is the first form of milk produced after birth, and it is rich in antibodies, proteins, and other nutrients that help protect the newborn from infections and support early development. 118. Pregnant women are not advised to travel by airplane due to the risks of complications at high altitudes. True or false? Answer: false. Rationale: air travel is generally safe for most pregnant women, especially during the second trimester. However, travel is not recommended in high-risk pregnancies or after 36 weeks due to the risk of premature labor and limited medical care during flight. 119. Rh-negative pregnant women must receive an injection of Rh immunoglobulin, ROGM, at 28 weeks gestation and after delivery if the baby is Rh positive. True or false? Answer: true. Rationale: Rh-negative women receive Rh immunoglobulin, ROGM, to prevent the development of antibodies against Rh-positive blood cells. The injection is typically given at 28 weeks gestation and within 72 hours after delivery if the baby is Rh positive. 120. After a cesarean delivery, a woman should avoid physical activity for at least 6 weeks to allow for proper healing. True or false? Answer: true. Rationale: after a cesarean delivery, the abdominal incision and uterus need time to heal. Women are typically advised to avoid strenuous physical activity for at least 6 weeks to prevent complications, such as wound dehiscence or uterine rupture. 121. Pregnant women should not consume alcohol under any circumstances due to the risk of fetal alcohol syndrome. True or false? Answer: true. Rationale: alcohol consumption during pregnancy can result in fetal alcohol syndrome, FAS, which can cause developmental delays, birth defects, and other serious health issues for the baby. No safe amount of alcohol is known during pregnancy. 122. A woman should begin breastfeeding immediately after delivery, even if she is exhausted from labor. True or false? Answer: true. Rationale: Early initiation of breastfeeding, ideally within the first hour after delivery, helps promote bonding, stimulates milk production, and provides the newborn with essential colostrum. 123, a non-stress test, NST, is used to assess fetal heart rate patterns and determine fetal well-being during late pregnancy. True or false? Answer: true. Rationale, a non-stress test, NST, measures fetal heart rate in response to fetal movements to assess fetal well-being. It is commonly used in late pregnancy to monitor for signs of fetal distress. 124. A vaginal delivery is always the safest and best option for all women. True or false? Answer: false. Rationale. While vaginal delivery is generally considered the safest option, some women may require a cesarean delivery due to complications such as breech presentation, fetal distress, or maternal health issues. 125. It is recommended that pregnant women receive an influenza, flu, vaccine during flu season.
True or false?
Answer: true. Rationale. Pregnant women are at higher risk for severe complications from the flu. The flu vaccine is recommended during pregnancy to protect both the mother and fetus from serious illness. 126. Labor induction is often used for women who are post-term to reduce the risk of complications. True or false? Answer: true. Rationale. Labor induction is commonly recommended for women who are post-term, past 42 weeks of gestation, to reduce the risk of complications such as stillbirth, meconium aspiration, and fetal macrosomia. 127. A pregnancy test detects the presence of the hormone progesterone in the blood or urine. True or false? Answer: false. Rationale. A pregnancy test detects the presence of human chorionic gonadotropin, HCG, not progesterone. HCG is produced after implantation of the fertilized egg, signaling pregnancy. 128. Prenatal care visits should begin during the first trimester to ensure early detection of potential complications.
True or false?
Answer: true. Rationale. Early prenatal visits help identify any risks or complications such as gestational diabetes, hypertension, or genetic concerns. Early intervention is crucial for maternal and fetal health. 129. Women with a history of gestational diabetes are at increased risk of developing type 2 diabetes later in life. True or false? Answer: true. Rationale. Women who experience gestational diabetes are at a significantly higher risk of developing type 2 diabetes in the future. Postpartum screening for glucose tolerance is recommended. 130. A normal fetal heart rate typically ranges from 120 to 160 beats per minute during the second trimester of pregnancy. True or false? Answer: true. Rationale. A normal fetal heart rate during the second trimester typically ranges from 120 to 160 beats per minute. Deviations from this range may indicate potential issues, such as fetal distress or hypoxia. 131. During pregnancy, women are more susceptible to respiratory infections due to changes in the immune system. True or false? Answer: true. Rationale. Pregnancy causes changes in the immune system, leading to increased susceptibility to respiratory infections. Hormonal changes and altered lung function contribute to this risk. 132. It is important for pregnant women to avoid exposure to cats due to the risk of toxoplasmosis.
True or false?
Answer: true. Rationale. Toxoplasmosis is a parasitic infection that can be transmitted through cat litter or undercooked meat. It can lead to severe complications for the fetus, including developmental delays and brain damage. 133. Pregnant women are advised to avoid all over-the-counter medications, including pain relievers, during pregnancy.
True or false?
Answer: false. Rationale. While some over-the-counter medications should be avoided during pregnancy, certain pain relievers like acetaminophen are considered safe when used as directed. Pregnant women should consult with a healthcare provider before using any medication. 134. Excessive weight gain during pregnancy can increase the risk of gestational diabetes and preeclampsia.
True or false?
Answer: true. Rationale. Excessive weight gain during pregnancy increases the risk of complications such as gestational diabetes, preeclampsia, and macrosomia, large baby, which can result in delivery complications. 135. A woman's blood pressure typically decreases in the first trimester of pregnancy.
True or false?
Answer: true. Rationale: during the first trimester, blood pressure typically decreases due to hormonal changes, including increased progesterone, which causes blood vessel dilation. Blood pressure tends to rise again in the second and third trimesters. 136. The presence of protein in the urine during pregnancy may indicate preeclampsia.
True or false?
Answer: true. Rationale: protein in the urine is a key sign of preeclampsia, a pregnancy complication characterized by high blood pressure and kidney dysfunction. It is important to monitor for this sign, as preeclampsia can lead to serious maternal and fetal complications. 137. Pregnant women are not allowed to exercise during pregnancy.
True or false?
Answer: false. Rationale: exercise is generally safe for most pregnant women and can help with weight management, mood, and overall well-being. However, high-risk pregnancies may require modification or restriction of physical activity. 138. The uterus is located in the pelvis before pregnancy and moves upward as the pregnancy progresses.
True or false?
Answer: true. Rationale: during pregnancy, the growing fetus and uterus expand, causing the uterus to move upward into the abdominal cavity. The top of the uterus, fundus, can be felt in the lower abdomen during the first trimester and gradually rises higher. 139. Women who experience nausea and vomiting during pregnancy, commonly known as morning sickness, can take vitamin B6 supplements to help alleviate symptoms.
True or false?
Answer: true. Rationale: vitamin B6 supplements have been shown to be effective in alleviating mild nausea and vomiting during pregnancy, morning sickness. For severe cases, other treatments may be required under a doctor's supervision. 140. The risk of a miscarriage is highest during the first 6 weeks of pregnancy.
True or false?
Answer: true. Rationale: the first trimester, particularly the first 6 weeks, is the period when the risk of miscarriage is highest due to factors such as chromosomal abnormalities or issues with implantation. 141. An epidural block provides pain relief by numbing the lower half of the body during labor.
True or false?
Answer: true. Rationale: an epidural block provides regional anesthesia by injecting medication into the epidural space around the spinal cord. It numbs the lower half of the body, providing pain relief during labor while allowing the mother to remain awake. 142. A decrease in fetal movement is a sign of fetal distress and should always be reported to a healthcare provider.
True or false?
Answer: true. Rationale: a decrease in fetal movement can be a sign of fetal distress, and it should always be reported to a healthcare provider for further evaluation. Regular fetal movement is an important indicator of fetal well-being. 143. The maternal hormone prolactin is responsible for initiating and maintaining milk production.
True or false?
Answer: true. Rationale: prolactin is the hormone responsible for stimulating milk production after childbirth. It helps the mammary glands produce milk, allowing the mother to breastfeed. 144. A blood pressure reading of 140/90 mmHg or higher is considered abnormal and should be monitored during pregnancy.
True or false?
Answer: true. Rationale: a blood pressure of 140/90 mmHg or higher is considered high during pregnancy and could indicate gestational hypertension or preeclampsia. Close monitoring is necessary to prevent complications. 145. The hormone relaxin is responsible for loosening the ligaments and joints of the pelvis in preparation for delivery.
True or false?
Answer: true. Rationale: relaxin is a hormone produced during pregnancy that helps soften and relax the ligaments and joints, especially in the pelvic area, to accommodate the growing fetus and facilitate delivery. 146. The Barlow maneuver is used to assess for hip dysplasia in newborns.
True or false?
Answer: true. Rationale: the Barlow maneuver is a clinical test used to detect hip dysplasia in newborns. It involves gently dislocating the hip to see if it can be relocated, helping to identify any hip instability or dysplasia. 147. Anemia during pregnancy is common and usually resolves after childbirth without treatment.
True or false?
Answer:
False.
Rationale: anemia during pregnancy, often caused by iron deficiency, can be treated with iron supplements. It does not typically resolve without intervention and requires proper management to ensure maternal and fetal health. 148. The cervix typically dilates to 10 centimeters during the first stage of labor in preparation for delivery.
True or false?
Answer: true. Rationale: the cervix dilates from 0 to 10 centimeters during the first stage of labor, allowing the baby to pass through the birth canal. Full dilation, 10 centimeters, is necessary for the second stage of labor, which involves pushing and delivery. 149. Postpartum hemorrhage is a rare complication and is usually preventable with proper prenatal care.
True or false?
Answer:
false.
Rationale: postpartum hemorrhage is a serious complication that occurs in approximately 5% of births and can be caused by uterine atony, retained placenta, or other factors. It is not always preventable, but proper prenatal care and immediate postpartum management can help reduce the risk. 150. Women who are breastfeeding are more likely to experience postpartum depression than non-breastfeeding mothers.
True or false?
Answer:
false.
Rationale: while postpartum depression can affect any new mother, studies have shown that breastfeeding may actually reduce the risk of postpartum depression due to the hormonal and emotional bonding effects associated with breastfeeding. 151. A woman who has an episiotomy should receive pain relief in the form of a local anesthetic after delivery.
True or false?
Answer: true. Rationale: an episiotomy is a surgical incision made in the perineum to facilitate delivery. Local anesthetics or other forms of pain relief are often administered to manage discomfort during healing. 152. Women with gestational diabetes may be required to modify their diet and exercise routine to control blood glucose levels.
True or false?
Answer: true. Rationale: gestational diabetes can be managed through diet, exercise, and sometimes medication. Monitoring blood glucose levels and making lifestyle changes are essential to ensure a healthy pregnancy and prevent complications. 153. After delivery, it is common for women to experience a slight fever as the body adjusts.
True or false?
Answer: true. Rationale: a slight fever after delivery, especially within the first 24 hours, is common due to the body's inflammatory response to childbirth. However, a high fever may indicate infection and should be evaluated. 154. A vaginal birth is generally considered the most cost-effective and safest delivery option for women with low-risk pregnancies.
True or false?
Answer: true. Rationale: vaginal birth is typically less expensive and carries fewer risks than a cesarean delivery for low-risk pregnancies. It allows for a quicker recovery and generally results in fewer complications. 155. A cesarean delivery is the preferred method of delivery for women who have a breech presentation.
True or false?
Answer: true. Rationale: breech presentation, when the baby is positioned feet or buttocks first, often requires a cesarean delivery due to the increased risks of umbilical cord prolapse, head entrapment, or trauma during vaginal birth. 156. During pregnancy, the body produces more blood to support the growing fetus and placenta.
True or false?
Answer: true. Rationale: blood volume increases during pregnancy to meet the demands of the fetus and placenta, as well as to support the maternal cardiovascular system. This increase helps ensure adequate oxygen and nutrient delivery. 157. If a woman has a history of preterm labor, she will automatically require a cervical circlage in subsequent pregnancies.
True or false?
Answer:
false.
Rationale: while a cervical circlage may be recommended for women with a history of preterm labor due to cervical insufficiency, it is not automatically required for all women. The decision depends on individual factors, including the severity of prior preterm labor. 158. Maternal smoking during pregnancy is associated with an increased risk of low birth weight.
True or false?
Answer: true. Rationale: Smoking during pregnancy reduces oxygen and nutrient supply to the fetus, which can result in intrauterine growth restriction and low birth weight. It also increases the risk of other complications like preterm birth. 159. Women with gestational hypertension are at a higher risk of developing chronic hypertension later in life.
True or false?
Answer: true. Rationale: women with gestational hypertension are at increased risk of developing chronic hypertension later in life, as the condition can be a precursor to long-term blood pressure issues. Postpartum follow-up and monitoring are essential. 160. Folic acid supplementation before and during pregnancy helps prevent neural tube defects in the developing fetus.
True or false?
Answer: true. Rationale: folic acid is essential for fetal neural tube development. Adequate intake of folic acid before and during early pregnancy significantly reduces the risk of neural tube defects like spina bifida and anencephaly. 161. During the second trimester, the mother's blood pressure should remain the same as it was before pregnancy.
True or false?
Answer: false. Rationale: blood pressure typically decreases during the second trimester due to hormonal changes that cause blood vessel relaxation. It may return to pre-pregnancy levels in the third trimester. 162. Hyperemesis gravidarum is a severe form of nausea and vomiting that can lead to dehydration and weight loss during pregnancy.
True or false?
Answer: true. Rationale: hyperemesis gravidarum is a more severe form of nausea and vomiting in pregnancy, which can cause dehydration, weight loss, and electrolyte imbalances. It often requires medical treatment, including hydration and antiemetic medications. 163. A positive direct Coombs test indicates that a pregnant woman is at risk for Rh incompatibility.
True or false?
Answer: true. Rationale: a positive direct Coombs test in a pregnant woman indicates that antibodies have attacked the red blood cells, suggesting Rh incompatibility. If the mother is Rh negative and the fetus is Rh positive, Rh immunoglobulin may be needed to prevent complications. 164. The lochia flow after delivery should gradually decrease over the first few weeks.
True or false?
Answer: true. Rationale: lochia is the vaginal discharge after childbirth, which consists of blood, mucus, and uterine tissue. It typically decreases in amount and changes in color over a few weeks, starting as bright red and becoming lighter and more watery. 165. If a pregnant woman is diagnosed with preeclampsia, her blood pressure will be elevated and protein will be present in the urine.
True or false?
Answer: true. Rationale: preeclampsia is characterized by high blood pressure and the presence of protein in the urine. It can lead to serious complications, including organ damage and preterm birth, if left untreated. 166. Gestational hypertension typically resolves after delivery without treatment.
True or false?
Answer: true. Rationale: gestational hypertension, defined as high blood pressure during pregnancy, usually resolves after delivery. However, it requires careful monitoring, as it can progress to preeclampsia or lead to future cardiovascular issues. 167. A woman's risk of developing gestational diabetes increases with increasing age, especially after 35 years old.
True or false?
Answer: true. Rationale: advanced maternal age, particularly over 35 years, increases the risk of gestational diabetes due to changes in insulin sensitivity and the body's ability to regulate glucose. 168. Women with a BMI of 30 or higher before pregnancy are at a higher risk of developing gestational diabetes.
True or false?
Answer: true. Rationale: obesity is a significant risk factor for gestational diabetes, as it can lead to insulin resistance. Pregnant women with a BMI of 30 or higher are more likely to develop gestational diabetes and related complications. 169. It is not necessary for a woman with a low-risk pregnancy to receive any prenatal screening or testing.
True or false?
Answer: false. Rationale: even women with low-risk pregnancies should undergo routine prenatal screening and testing to monitor fetal development and detect any potential issues. Examples include routine blood tests, ultrasounds, and fetal heart rate monitoring. 170. The primary purpose of the amniotic fluid is to cushion and protect the fetus.
True or false?
Answer: true. Rationale: amniotic fluid provides a cushion for the fetus, protecting it from external pressure or trauma. It also helps regulate temperature, allows for fetal movement, and plays a role in lung and digestive system development. 171. A woman can safely continue taking her pre-pregnancy medications without modification during pregnancy.
True or false?
Answer: false. Rationale: many medications need to be adjusted or discontinued during pregnancy due to potential risks to the developing fetus. Healthcare providers must assess the safety of each medication and consider alternatives. 172. The presence of a fetal heartbeat detected by ultrasound at 12 weeks is a reassuring sign of fetal well-being.
True or false?
Answer: true. Rationale: the presence of a fetal heartbeat at 12 weeks is a reassuring sign that the pregnancy is progressing normally. It indicates that the fetus is alive and that there is adequate blood flow to the developing organs. 173. A woman who has had a stillbirth is at increased risk of experiencing preterm labor in subsequent pregnancies. True or false? Answer: true. Rationale: women with a history of stillbirth are at increased risk of preterm labor in future pregnancies. Careful monitoring and management are necessary to reduce the risks in subsequent pregnancies. 174. Epidural anesthesia can cause hypotension in the mother, which may affect fetal well-being. True or false? Answer: true. Rationale: epidural anesthesia can cause a drop in maternal blood pressure due to the relaxation of blood vessels. This hypotension can reduce uteroplacental blood flow and potentially compromise fetal oxygenation, requiring close monitoring and treatment. 175. If a woman is diagnosed with preeclampsia, she may be required to deliver the baby prematurely.
True or false?
Answer: true. Rationale: if preeclampsia becomes severe or life-threatening for the mother or fetus, early delivery may be necessary, even if the pregnancy is not full-term, to prevent further complications such as eclampsia, organ damage, or fetal distress. 176. An elevated blood sugar level after a glucose challenge test confirms a diagnosis of gestational diabetes.
True or false?
Answer: false. Rationale: an elevated blood sugar level after a glucose challenge test indicates the need for further testing, such as a 3-hour glucose tolerance test, to confirm or rule out a diagnosis of gestational diabetes. 177. A healthy pregnancy typically includes an increase in the production of the hormone progesterone.
True or false?
Answer: true. Rationale: progesterone levels increase during pregnancy to support the uterine lining, prevent contractions, and help maintain pregnancy. It also plays a role in preparing the body for labor and breastfeeding. 178. Women who are at risk of preterm labor may be prescribed medications to stop contractions. True or false? Answer: true. Rationale: medications such as tocolytics may be prescribed to halt preterm labor by relaxing the uterus and stopping contractions, providing time for fetal development and reducing the risks associated with premature birth. 179. A normal newborn heart rate is between 110 and 160 beats per minute.
True or false?
Answer: true. Rationale: a normal newborn heart rate typically ranges from 110 to 160 beats per minute. This is considered a healthy range for a full-term infant, although it can vary slightly. 180. Rh-negative women with Rh-positive partners should receive Rh immunoglobulin during pregnancy to prevent Rh incompatibility.
True or false?
Answer: true. Rationale: Rh immunoglobulin, Rhig, is given to Rh-negative women to prevent the formation of antibodies against Rh-positive fetal blood cells. This helps prevent hemolytic disease of the newborn in future pregnancies. 181. A woman with a history of gestational diabetes is at risk for developing type 2 diabetes later in life. True or false? Answer: true. Rationale: women with a history of gestational diabetes have an increased risk of developing type 2 diabetes later in life due to insulin resistance. Lifestyle changes and regular monitoring are important for prevention. 182. The fetal heart rate should be assessed regularly during labor to monitor fetal well-being.
True or false?
Answer: true. Rationale: continuous or intermittent fetal heart rate monitoring during labor is essential to assess fetal well-being, detect signs of fetal distress, and guide delivery decisions. 183. Women who are pregnant with multiples are at higher risk for preterm labor.
True or false?
Answer: true. Rationale: pregnancies with multiples, twins, triplets, etc., have a higher risk of preterm labor due to the increased uterine stretching and higher levels of hormones, which can trigger early contractions. 184. The process of labor involves 3 stages: dilation, delivery of the baby, and delivery of the placenta.
True or false?
Answer: true. Rationale: labor is divided into 3 stages. The first stage involves cervical dilation, the second stage involves the delivery of the baby, and the third stage involves the expulsion of the placenta. 185. A maternal fever of 100.4 degrees Fahrenheit or higher in the immediate postpartum period may indicate an infection. True or false? Answer: true. Rationale: a postpartum fever of 100.4 degrees Fahrenheit or higher can indicate an infection, such as endometritis, urinary tract infection, or mastitis. It requires prompt evaluation and treatment. 186. Placenta previa is a condition in which the placenta is implanted in the lower part of the uterus, obstructing the cervical opening. True or false? Answer: true. Rationale: placenta previa occurs when the placenta implants near or over the cervix, which can lead to bleeding and complications during delivery, often requiring a cesarean section. 187. Women who experience heavy bleeding during pregnancy should always seek medical attention, as it can indicate a miscarriage or other complications.
True or false?
Answer: true. Rationale: heavy bleeding during pregnancy may indicate a miscarriage, ectopic pregnancy, or placental abruption. It is crucial for women to seek medical attention immediately for appropriate evaluation. 188. The hormone oxytocin plays a role in both labor contractions and milk ejection.
True or false?
Answer: true. Rationale: oxytocin is involved in labor by stimulating uterine contractions. After delivery, it also promotes the milk ejection reflex, allowing for breastfeeding. 189. A woman with a BMI less than 18.5 is considered to be at a higher risk for preterm birth.
True or false?
Answer: true. Rationale: women with a low BMI, underweight, are at increased risk for preterm birth, low birth weight, and fetal growth restrictions due to insufficient nutritional reserves and potential complications in pregnancy. 190. A maternal blood pressure reading of 160/110 mmHg during pregnancy is indicative of severe preeclampsia.
True or false?
Answer: true. Rationale: a blood pressure of 160/110 mmHg or higher during pregnancy is a hallmark of severe preeclampsia. This requires urgent medical intervention to prevent complications like stroke, organ damage, or fetal distress. 191. Prenatal vitamins should be taken by pregnant women to ensure adequate nutrition for both mother and baby.
True or false?
Answer: true. Rationale: prenatal vitamins provide essential nutrients such as folic acid, iron, and calcium, supporting the health of both mother and developing fetus. They help prevent deficiencies and complications. 192. All pregnant women should have a routine ultrasound during the first trimester to assess fetal viability.
True or false?
Answer: false. Rationale: while ultrasounds are common in early pregnancy, they are not always routine for all women. However, they may be performed to confirm pregnancy, estimate gestational age, or identify any complications. 193. Maternal stress during pregnancy can increase the risk of preterm birth and low birth weight.
True or false?
Answer: true. Rationale: high levels of maternal stress can increase the production of stress hormones, which may contribute to preterm birth, low birth weight, and complications like high blood pressure and gestational diabetes. 194. An emergency cesarean section may be required if there is fetal distress, such as an abnormal fetal heart rate.
True or false?
Answer: true. Rationale: if fetal distress is detected, such as a significant change in fetal heart rate, an emergency cesarean section may be necessary to prevent further harm to the fetus and ensure a safe delivery. 195. Women who are breastfeeding should avoid alcohol consumption, as it can affect milk production and infant development.
True or false?
Answer: true. Rationale: alcohol can pass into breast milk, affecting milk production and infant development. It is recommended that breastfeeding women avoid alcohol or limit intake to ensure infant safety and optimal nutrition. 196. A retained placenta occurs when parts of the placenta remain in the uterus after delivery.
True or false?
Answer: true. Rationale: a retained placenta can occur if portions of the placenta remain in the uterus after delivery. This can lead to hemorrhage or infection and may require medical intervention, such as manual removal. 197. A breech baby can be safely delivered vaginally as long as the baby is in a frank breech position.
True or false?
Answer: false. Rationale: while a frank breech, legs extended upward, may sometimes be delivered vaginally, most breech presentations are considered high risk for vaginal delivery. A cesarean section is generally recommended for breech presentations to prevent complications. 198. The APGAR score is a quick assessment of a newborn's physical condition immediately after birth.
True or false?
Answer: true. Rationale: the APGAR score assesses a newborn's appearance, pulse, grimace, activity, and respiration at 1 and 5 minutes after birth to determine the infant's overall health and need for resuscitation. 199. Vaginal bleeding in the third trimester is always a sign of labor.
True or false?
Answer: false. Rationale: vaginal bleeding in the third trimester may indicate complications like placental abruption, placenta previa, or other issues, but it is not always associated with labor. Immediate medical evaluation is required. 200. Women who develop preeclampsia must deliver the baby as soon as possible, regardless of gestational age.
True or false?
Answer: false. Rationale: while preeclampsia can be serious, the timing of delivery depends on the severity of the condition and gestational age. In mild cases, the baby may be delivered after reaching a viable gestational age, while severe preeclampsia may require earlier delivery. 201. A woman who has an elective cesarean section should receive antibiotics to prevent postoperative infection.
True or false?
Answer: true. Rationale: antibiotic prophylaxis is commonly given before elective cesarean sections to prevent infections such as endometritis, which can occur after surgical procedures. 202. Gestational hypertension is defined as high blood pressure that develops after the 20th week of pregnancy and resolves after delivery.
True or false?
Answer: true. Rationale: gestational hypertension develops after the 20th week of pregnancy and resolves within 12 weeks postpartum. It requires monitoring to prevent progression to preeclampsia or other complications. 203. A woman with pre-existing diabetes must maintain strict blood glucose control throughout pregnancy to reduce the risk of birth defects.
True or false?
Answer: true. Rationale: strict blood glucose control is crucial for women with pre-existing diabetes during pregnancy. Poor glucose control increases the risk of birth defects, including neural tube defects and cardiac anomalies. 204. Women who have had a cesarean section in the past should always deliver subsequent babies by cesarean section.
True or false?
Answer: false. Rationale: while cesarean deliveries in the past can increase the risk of complications, women who have had a previous cesarean may be eligible for a vaginal birth after cesarean (VBAC), depending on the type of incision and other factors. 205. Postpartum hemorrhage is defined as the loss of more than 500 milliliters of blood after vaginal delivery.
True or false?
Answer: true. Rationale: postpartum hemorrhage is defined as the loss of more than 500 milliliters of blood following a vaginal delivery. It can be life-threatening and requires immediate intervention to prevent shock and other complications. 206. It is normal for a woman's weight to remain the same during the entire pregnancy. True or false? Answer: false. Rationale: It is not normal for a woman's weight to remain the same during pregnancy. Weight gain is expected due to the growing fetus, placenta, amniotic fluid, and maternal tissue changes. A healthy weight gain depends on the mother's pre-pregnancy BMI. 207. The risk of postpartum depression is higher in women who experience a traumatic delivery. True or false? Answer: true. Rationale: women who experience a traumatic or complicated delivery are at increased risk for postpartum depression. Stressful birth experiences can contribute to emotional difficulties, hormonal changes, and lack of support. 208. A positive result from a non-stress test, NST, indicates that the fetus is experiencing stress. True or false? Answer: false. Rationale: a positive non-stress test, NST, actually indicates fetal well-being. It is characterized by a reactive pattern, meaning the fetal heart rate accelerates with fetal movement, suggesting the fetus is not under stress. 209. Gestational hypertension is the same as preeclampsia.
True or false?
Answer: false. Rationale: gestational hypertension refers to elevated blood pressure after 20 weeks of pregnancy without protein in the urine. Preeclampsia includes both high blood pressure and proteinuria, and it carries a higher risk for maternal and fetal complications. 210. A woman's risk for gestational diabetes is increased if she is overweight or obese before pregnancy. True or false? Answer: true. Rationale: being overweight or obese before pregnancy increases a woman's risk for developing gestational diabetes due to insulin resistance and metabolic factors that affect glucose regulation. 211. The umbilical cord typically contains 2 arteries and 1 vein. True or false? Answer: true. Rationale: the umbilical cord usually contains 2 arteries and 1 vein. The 2 arteries carry deoxygenated blood from the fetus to the placenta, while the single vein carries oxygenated blood from the placenta to the fetus. 212. The presence of protein in the urine during pregnancy is a common finding and not necessarily a sign of preeclampsia. True or false? Answer: false. Rationale: protein in the urine during pregnancy is not a normal finding and may indicate preeclampsia or other renal conditions. It should be investigated further to assess maternal and fetal health. 213. An intrauterine device, IUD, is a safe form of contraception during pregnancy. True or false? Answer: false. Rationale: an IUD is not safe during pregnancy and should be removed if pregnancy is diagnosed. It can increase the risk of infection, miscarriage, or preterm labor. Women should confirm they are not pregnant before using an IUD. 214. Women should avoid physical activity during pregnancy to ensure fetal safety. True or false? Answer: false. Rationale: moderate physical activity is generally safe during pregnancy and can improve maternal cardiovascular health, reduce stress, and improve sleep. However, high-risk activities should be avoided, and exercises should be modified based on the individual's condition. 215. In the case of a missed miscarriage, the fetus dies but remains in the uterus without expelling. True or false? Answer: true. Rationale: a missed miscarriage occurs when the fetus dies but remains in the uterus without being expelled. It may be diagnosed during an ultrasound, and treatment options like a DNC or medication may be discussed. 216. During the second trimester, the risk of miscarriage decreases significantly. True or false? Answer: true. Rationale: the risk of miscarriage decreases significantly after the first trimester, particularly during the second trimester when the pregnancy is more established and the fetus is growing steadily. 217. A woman diagnosed with placenta previa should avoid any physical activity or intercourse. True or false? Answer: true. Rationale: women with placenta previa should avoid physical activity, including intercourse, as it can lead to bleeding and other complications. The placenta is positioned over or near the cervix, which can cause issues during labor. 218. The first postpartum menstruation typically occurs within 6 weeks after delivery. True or false? Answer: false. Rationale: the return of menstruation after childbirth varies depending on whether the woman is breastfeeding. Non-breastfeeding women may resume menstruation within 6 to 8 weeks, while breastfeeding can delay menstruation for several months. 219. Intrauterine growth restriction, IUGR, is a condition where the fetus is larger than expected for gestational age. True or false? Answer: false. Rationale: intrauterine growth restriction, IUGR, refers to a fetus that is smaller than expected for gestational age. It can be caused by various factors such as poor placental blood flow, maternal health conditions, or infections. 220. An early sign of labor is the breaking of the water, rupture of membranes. True or false? Answer: false. Rationale: the rupture of membranes, breaking of the water, is not always an early sign of labor. Many women experience labor contractions before their water breaks. It can happen at any time during labor or not at all. 221. A postpartum infection can occur if the cervix or uterus is not properly cleaned after delivery. True or false? Answer: true. Rationale: postpartum infections can occur if the cervix or uterus is not adequately cleaned, increasing the risk of infection like endometritis. Proper hygiene, timely antibiotics, and monitoring for signs of infection are essential postpartum. 222. The Bishop score is used to evaluate the readiness of the cervix for labor induction.
True or false?
Answer: true. Rationale: the Bishop score evaluates the cervix's readiness for labor induction based on factors like cervical dilation, effacement, consistency, position, and fetal station. A higher score indicates a more favorable cervix for induction. 223. A pregnant woman with a history of preeclampsia should not be monitored for blood pressure until the 3rd trimester. True or false? Answer: false. Rationale: women with a history of preeclampsia should be monitored closely for signs of high blood pressure throughout pregnancy, beginning in early pregnancy. Regular blood pressure checks are critical to detect preeclampsia early. 224. The most common complication of labor is prolonged labor, which can lead to cesarean delivery. True or false? Answer: true. Rationale: prolonged labor, also known as labor dystocia, is a common complication and can result from issues such as fetal malposition, uterine exhaustion, or maternal pelvic abnormalities. It increases the likelihood of requiring a cesarean section. 225. A healthy pregnancy includes adequate hydration and balanced nutrition to support both maternal and fetal needs. True or false? Answer: true. Rationale: proper hydration and balanced nutrition are essential during pregnancy to support the health of the mother and fetus. Nutrients like folic acid, calcium, and iron are vital for fetal development and preventing complications. 226. Maternal exposure to secondhand smoke during pregnancy is not as harmful as smoking directly. True or false? Answer: false. Rationale: maternal exposure to secondhand smoke is harmful and can result in complications such as low birth weight, preterm birth, and developmental delays. Both active and passive smoking pose significant risks to the fetus. 227. Prenatal care should begin as soon as pregnancy is suspected. True or false? Answer: true. Rationale: early prenatal care is essential for monitoring maternal and fetal health, screening for complications, and providing education on pregnancy, nutrition, and lifestyle changes. Early intervention can prevent or address potential risks. 228. A woman who experiences gestational hypertension is always at risk for developing preeclampsia. True or false? Answer: false. Rationale: while gestational hypertension can be a precursor to preeclampsia, not all women with gestational hypertension will develop preeclampsia. However, they require close monitoring to assess for the development of further complications. 229. Excessive weight gain during pregnancy can increase the risk of complications such as gestational diabetes and preeclampsia.
True or false?
Answer: true. Rationale: excessive weight gain during pregnancy can increase the risk of gestational diabetes, preeclampsia, and fetal macrosomia, large baby, and may complicate labor and delivery. Healthy weight gain guidelines are based on pre-pregnancy BMI. 230. A healthy maternal diet should include a variety of foods to ensure adequate intake of essential vitamins and minerals, such as folic acid and iron. True or false? Answer: true. Rationale: a balanced diet that includes foods rich in folic acid, iron, calcium, and protein is crucial during pregnancy. These nutrients support fetal development and prevent common pregnancy complications like neural tube defects and anemia. 231. The human papillomavirus, HPV, vaccine is recommended during pregnancy to prevent cervical cancer. True or false? Answer: false. Rationale: the HPV vaccine is not recommended during pregnancy. It is advised to wait until after delivery to receive the vaccine. Pregnant women should avoid vaccination with live vaccines unless absolutely necessary. 232. Vaginal exams are routinely performed in the first trimester of pregnancy to assess cervical length. True or false? Answer: false. Rationale: vaginal exams are not routinely performed in the first trimester unless there is a clinical indication, such as bleeding or suspected miscarriage. Cervical length is more commonly assessed in the second trimester, or if there are risk factors for preterm birth. 233. Maternal smoking during pregnancy can lead to low birth weight and developmental delays in the child.
True or false?
Answer: true. Rationale: maternal smoking during pregnancy reduces oxygen supply to the fetus and can lead to complications like low birth weight, preterm birth, and developmental delays. Smoking cessation during pregnancy is vital for both maternal and fetal health. 234. Amniocentesis is a screening test that is typically performed during the first trimester to assess for genetic abnormalities.
True or false?
Answer: false. Rationale: amniocentesis is typically performed in the second trimester, usually after 15 weeks, to assess for genetic abnormalities. First trimester screening tests, e.g., nuchal translucency ultrasound, blood tests, are non-invasive and carry fewer risks than amniocentesis. 235. A pregnant woman with a history of multiple preterm births is at higher risk for preterm labor in future pregnancies.
True or false?
Answer: true. Rationale: women with a history of multiple preterm births are at increased risk for preterm labor in subsequent pregnancies due to factors like cervical insufficiency, infections, or uterine abnormalities. They may require closer monitoring and early intervention. 236. A low APGAR score at 1 minute following birth is indicative of immediate life-threatening issues.
True or false?
Answer: false. Rationale: a low APGAR score at 1 minute does not necessarily indicate life-threatening issues. It is a quick assessment tool to evaluate the newborn's condition, but it is not always predictive of long-term health. A score of 7 to 10 is normal, while lower scores require intervention. 237. Preterm birth is defined as a birth that occurs before 37 weeks of gestation.
True or false?
Answer: true. Rationale: preterm birth occurs before 37 weeks of gestation. It is associated with an increased risk of complications, including respiratory distress syndrome, developmental delays, and long-term health issues for the infant. 238. Women who are breastfeeding should avoid caffeine, as it can interfere with milk production.
True or false?
Answer: false. Rationale: moderate caffeine intake is generally considered safe during breastfeeding. However, excessive caffeine can affect the infant's sleep patterns and cause irritability. It is recommended to limit caffeine intake rather than avoid it completely. 239. The use of herbal supplements during pregnancy should be avoided unless recommended by a healthcare provider.
True or false?
Answer: true. Rationale: many herbal supplements are not well studied in pregnancy and may have adverse effects on fetal development or pregnancy outcomes. Women should consult their healthcare provider before using any supplements during pregnancy. 240. A woman with polycystic ovary syndrome, PCOS, is at increased risk for complications such as gestational diabetes and preeclampsia during pregnancy.
True or false?
Answer: true. Rationale: women with PCOS are at higher risk for gestational diabetes, preeclampsia, and pregnancy complications such as preterm birth or miscarriage due to hormonal imbalances and insulin resistance. Regular monitoring is recommended. 241. The use of narcotics during labor can affect fetal respiratory function. True or false? Answer: true. Rationale: narcotics used during labor, such as meperidine or morphine, can cross the placenta and affect fetal respiratory function, leading to neonatal respiratory depression. It is important to carefully manage medication and provide appropriate monitoring. 242. The presence of a greenish meconium-stained amniotic fluid during labor may indicate fetal distress. True or false? Answer: true. Rationale: greenish meconium-stained amniotic fluid can indicate fetal distress, as it suggests that the fetus has past meconium in utero. This can increase the risk of meconium aspiration syndrome, which requires immediate neonatal care after birth. 243. All pregnant women should undergo a glucose challenge test at 24 to 28 weeks gestation to screen for gestational diabetes. True or false? Answer: true. Rationale: a glucose challenge test, GCT, is routinely performed between 24 and 28 weeks gestation to screen for gestational diabetes. It helps identify women who may require further testing and management to prevent complications. 244. It is normal for pregnant women to feel increased fatigue, especially during the first and third trimesters. True or false? Answer: true. Rationale: increased fatigue is common in the first and third trimesters due to hormonal changes, increased metabolic demands, and physical strain. Women should rest and prioritize self-care during pregnancy to manage fatigue. 245. The routine use of an epidural during labor is recommended for all pregnant women. True or false? Answer: false. Rationale: the use of an epidural is a personal choice and is not recommended for all women. While it can provide effective pain relief, it is not suitable for every woman due to factors like medical conditions or preferences for natural childbirth. 246. Postpartum depression is less likely to affect women who have a strong support system. True or false? Answer: true. Rationale: a strong support system can help reduce the risk of postpartum depression by providing emotional, physical, and social support to the new mother. Social isolation and lack of support can increase the likelihood of developing depression after childbirth. 247. The presence of a rapid, shallow breathing pattern in a newborn may be a sign of respiratory distress. True or false? Answer: true. Rationale: rapid, shallow breathing in a newborn can be a sign of respiratory distress, which may result from conditions like neonatal respiratory distress syndrome or meconium aspiration. Immediate evaluation and support are needed to assess and manage respiratory function. 248. The risk of developing an ectopic pregnancy is higher in women with a history of pelvic inflammatory disease, PID. True or false? Answer: true. Rationale: a history of pelvic inflammatory disease, PID, increases the risk of ectopic pregnancy due to scarring or damage to the fallopian tubes, which can prevent the fertilized egg from traveling to the uterus. 249. The presence of a positive human chorionic gonadotropin, HCG, test indicates a confirmed pregnancy. True or false? Answer: false. Rationale: a positive HCG test indicates that pregnancy is likely, but it does not confirm pregnancy. An ultrasound or further clinical assessment is needed to confirm the presence of a viable intrauterine pregnancy. 250. Breastfeeding reduces the risk of postpartum hemorrhage by promoting uterine contractions. True or false? Answer: true. Rationale: breastfeeding stimulates the release of oxytocin, which helps promote uterine contractions and reduces the risk of postpartum hemorrhage. The contractions help to constrict blood vessels and reduce excessive bleeding after delivery.